In this video, we're going to be talking about anterior pelvic tilt or lower cross syndrome. So what's that? Well, from the side, the spine should have three curves. One from the front, opposite, and forward again on the lower back. Now, anterior pelvic tilt is when you have now too much curve, too much lumbar lordosis. Lordosis is a curve, and now you have hyperlordosis, so too much curve. The low back goes forward like that, and the pelvis goes forward as well. So you're going to be doing that right there. Now, the problem with this is going to cause uneven pressure on the joints of the lower back. You're going to have some extension there on the lower back. There's going to be some pressure on the facet joints of the spine. These are the facets, so that can cause some facet syndrome, some pain on the lower back. And sometimes it can cause spondylolisthesis. This is when vertebra goes forward like this, and that can lead to some nerve pressure. This usually happens on L5, the last vertebra of the lower back, or L4. Right? So that can lead to degenerative changes, and that can cause that condition. Now, if you see this X-ray from the side, this is the lower back, this is the front, the back, this is the sacrum right here. Now, if I throw a line, the green is where the spine should be, this spine is going forward, and the sacrum, instead of being here, is pretty high. Pelvis is going forward, and if I throw a line on L3, middle of the lower back, on that vertebra, going down, this line normally should intersect or pass through the sacrum. As you see, it's not even touching the sacrum. So there's some anterior pelvic tilt. Again, that can lead to some low back pain. Now, there's going to be some muscle imbalances when you have this condition. This is the lower cross syndrome or anterior pelvic tilt right here. And when the pelvis goes forward, there's going to be tension on the psoas muscle, the hip flexors right here. That muscle goes from the lower back to the front of the hip. The low back muscles like the QL is a muscle that goes from the pelvis to the lower back and the last rib. And the erector spina or paraspinals are going to be really tight. Then there's going to be some weakness on the glutes and the abdominals. So you see it's crossed. This is too tight, and this is too weak. So we need to correct that with adjustments and exercise. So I'm going to teach you some exercises to stretch the muscles that are too tight and strengthen muscles that are too weak. Okay, first things first, we need to know what's anterior pelvic tilt and posterior pelvic tilt and how to do that. So you're going to stand from the side like this, so you can see it on the mirror probably. And this is anterior pelvic tilt, and this is posterior pelvic tilt. Anterior pelvic tilt, posterior pelvic tilt. A lot of people don't have that movement. When I tell them to do posterior and anterior pelvic tilt, they start doing this. And no, you should be going like this. When you play golf, this is where when you're going to hit a ball, if you have too much anterior pelvic tilt, you won't have a lot of rotation on your pelvis. Same thing if you have too much posterior pelvic tilt. So you need to be about neutral, and that's how you go. So practice this, anterior, posterior. If you don't have that movement, most likely is that your pelvis is stuck in anterior pelvic tilt or posterior pelvic tilt. So go anterior, posterior, and then find your neutral. That's neutral. That's anterior, posterior, and neutral. Do at least 10 repetitions of that to find your neutral, and practice doing that posterior pelvic tilt right there. So you want to bring the pelvis back, bring your coccyx, your sacrum down and in, right there, and engage your core. Imagine that you're bringing your belly button to your spine, right there. So we did the anterior and posterior pelvic tilt standing up. Now we're going to do it in a cat-cow position. So this is anterior pelvic tilt, this is posterior pelvic tilt. So you want to go from neutral to posterior pelvic tilt. Okay? So just like a cat and cow, bring the pelvis back, bring the head down, and go back to neutral. You don't want to go to anterior pelvic tilt, that's where you are already. So you want to practice going back. Do 10 repetitions, take a rest,
and then do 3 sets.
So remember, posterior
Going that way.
Now we're going to try the posterior pelvic tilt laying down.
So you're going to go flat.
If you have anterior pelvic tilt, it's going to be a big gap here, curve, and you're going to put your legs like this, and what you're going to do is try to flatten out your back. Remember, bring the pelvis that way, flatten up the gap that you have there by bringing your belly button in and your pelvis back. Back to neutral and hold it. 1, 2, 3. Go back to neutral and come back. 1, 2, 3, 4, 5. Okay, so hold it 3 to 5 seconds and then relax. The goal is to flatten out the back by bringing your pelvis back. So you don't have any gap here. And go. As you can see, I have a gap right now, and now it's flat. Back to neutral and flat. Do 3 sets, 10 repetitions. Remember that most of the time when we have anterior pelvic tilt, we will have weak abdominal muscles and weak glutes. So we're going to strengthen the glutes by doing glute bridges. Okay? So lay down flat, feet close to your buttocks, and you're going to bring your pelvis up. We have done this exercise before. Squeeze your glutes and bring your pelvis back. So remember, bring your belly button to your spine and bring the pelvis here. Squeeze your glutes and then go down. Posterior pelvic tilt, squeeze your glutes, bring your belly button, squeeze that right there, strengthen the glutes, and then go down. And then go down. Do 3 sets of 10 repetitions. Sometimes you might even get a cramp on your hamstring. Stretch a little bit. If that happens a lot, this means that you have pretty weak hamstrings, okay? But focus more on the glutes, on that movement by squeezing your glutes. Imagine that you have like a grate in between your butt cheeks and you want to squash that grate with your butt cheeks. That is your good contraction. And remember, going out and scooping your pelvis posteriorly, squeezing your butt cheeks, okay? To strengthen the core, we like to do planks. In this plank, we're going to be working on the abdominals, but we're going to be engaging the glutes as well. Usually it's like a normal plank, so you set up, interlace your fingers, elbows below your shoulders, and instead of being here, you're going to go a little bit higher. And you're going to engage your glutes and your core. You're going to hold that starting 30 seconds. If this 30 seconds is easier for you, then go to 45 or build up to a minute, okay? Not here, a little bit higher in this case to get more engagement of the glute and of your core. Do 3 repetitions, start with 30 seconds, then build it up to 45 seconds to a minute. Now moving on to the psoas muscle. Psoas muscle attached from the lower back to the front of your hip. And when it's tight, it will bring your pelvis into anterior tilt. And this happens when you sit for long hours. That muscle gets shorter and this will bring the pelvis forward, okay? So how you're going to stretch that one? We have done this one before as well. So you're going to go here 90 degrees and then you're going to bring this down. Now, one of the most common mistakes when people are doing this stretch is that they go down but they are still in anterior pelvic tilt. That's not how you do it. You want to go down when as soon as you start to feel the stretch, you want to bring the pelvis back. Posterior pelvic tilt, okay? And you feel a good stretch, right? So again, from here, go down. As soon as you start to feel the stretch right there, bring the pelvis back. Posterior pelvic tilt, and hold that position. You can hold that for 10 to 15 seconds or 20 seconds and then go back. To get a better stretch, you can go down, bring the pelvis back. You can rotate to the opposite direction, or you can bring your hands up like that, or you can do both. You can go to the position, bring the pelvis back, bring one hand up, and then rotate to the opposite direction, and you will feel a better stretch there on the psoas muscle. So I'm going to do it. Another hip flexors that gets tight is the quad. Okay, you have the psoas, iliopsoas right here that goes from the lower back to the hip, but then you have another hip flexor that is right here, the quad. How you stretch that? Well, almost the same position as the psoas muscle, but now you're going to bring that knee up. Okay, so find something to hold you, and you're going to go there that into dorsiflexion of this foot, and then bring that in. Okay, one of the most common mistakes right now you're doing right here, too much anterior pelvic tilt. So remember, go and try to have a little bit of posterior pelvic tilt to get more stretch in that muscle. Okay, and go down, feel it really good right there, and bring it back. So the next exercise is going to check our coordination. So let's see if we can do a dead bug. You're going to lay down facing up. Remember, you don't want to see any gap here. You want to bring your pelvis into posterior pelvic tilt, flatten out your back as far as possible. Go into this position, and you're going to go opposite. So you're going to extend the right arm and the left leg. Right? Try to keep the low back as close as possible to the floor. Okay? Posterior pelvic tilt at all times, and then do the opposite. This is harder than it looks. Most likely at the beginning you're not going to be that coordinated, especially when you're trying to keep the lower back on the floor. And you have to think about this. Okay? Try to keep again posterior pelvic tilt. Try not to have a gap. And go. Okay. Try to do 10 or 5. Start with 5 in each side, then build it up to 10. 3 rounds. Remember, having the low back flat as best as possible on the mat. That's the goal. Now on this one, you want to go into a deep squat. You want to have your heels on the floor. You want to grab to something sturdy, and then just stretch your lower back. Okay? And I'm feeling a stretch right here on my lower back. So I'm going to try to go a little bit far away and get a better stretch. This is stretching the erector spinae on your lower back. Really good stretch right there. You can go a little bit far away, and you can pull a bit. This is not too sturdy. I'm gonna probably hit my head with the desk, but get a pole or something, or a wall that you know that can hold your weight, and then just go like that. And that's a good way to stretch your lower back. So try that. Hold those, again, those stretches you want to hold 10, 15, 20 seconds. Now this one right here is a combined exercise. We're going to strengthen the glute, but at the same time, we're stretching the hip flexors. Okay? So you're going to go like in a split squat position, so like in a lunge position, and you're going to start to feel a stretch on my right, well, you won't feel it, but I feel it on my right psoas, and I'm loading my glute right here, and I'm going to bend forward and loading my glute right there, and then I'm coming up on extension. So when I'm here, I'm working on my glute, my left glute, and then I go into extension, boom, and I feel the stretch on my right hip flexor. So you can see it this way. So you go like this, go forward, you load your glute, and then come into extension. Remember, posterior pelvic tilt, and you feel the stretch on your hip flexor. It's a little bit more advanced, but I think it's simple enough for a lot of people to do. Okay? So try that. Do at least, remember, 10 repetitions on each side, 3 sets.